Hello, Dr. T. Welcome back. We're at segment number 3. Today's topic is fibroids. What are fibroids? What are these pesky little tumors that drive women crazy when they hear the diagnosis? Leiomyoma uteri. Technically, it's just the growth of the muscle of the uterus. The uterus is a muscle, a very powerful muscle, powerful enough to hold a baby, 2 babies, 3 babies, and then powerful enough to force them out when labor occurs. Ironically, hysterectomy, removal of the uterus, many times for fibroids, was the most common operation in the United States prior to the HMO beginnings. I find it fascinating that when the doctors had to pay for the surgery, many hysterectomies were no longer necessary, indicating, of course, that fibroids in and of themselves certainly do not need to be removed. It's estimated that half of all women over 30 have these fibroid tumors. Most of them are small or located in the wall of the uterus where they cause no problem. If they're located inside the uterus, these are called submucous fibroids, they can cause a plethora of problems, most commonly bleeding, and sometimes it can be staggering amounts of bleeding. So if you're diagnosed with fibroids, typically nothing really will ever have to be done. If you have a bleeding problem, ultrasound can show where the fibroids are located. There are non-surgical procedures such as embolization that will shrink the fibroids. Sometimes for infertility cases, the fibroids themselves can be removed and the uterus does not have to be removed. So if your family practice doctor tells you that you have fibroid tumors, and I really dislike the word tumors, although technically it is correct, tumors evokes cancer. Fibroids are not cancer. They don't become cancerous. The most common problem, as I said, is bleeding, and if you have a problem with that, you might have to have your fibroids dealt with. Occasionally I like to end these segments with what I think is a funny anecdote. Years ago, I was approached by a patient wanting information on a tubal litigation. As most of you know, litigation, of course, is a lawsuit. Most doctors know what lawsuits are. Ligation is a blockage of the fallopian tubes for infertility. Occasionally, a tubal ligation does result in tubal litigation. If the patient gets pregnant, obviously they're upset and there can be lawsuits. In any case, I hope I've answered and cured some of your fears on fibroids. I'll look forward to seeing you on our next segment. Dr. T, have a great day. Goodbye.